always keep everything in front of you. Y'all might know a little something this morning. Number 7, let every glad heart say, let every glad heart say, a man again. I thought y'all went to church. Come on now. I thought y'all went to church. All right. Here's the street saying. I ain't blank in town. I've been around. I ain't new in town. I've been around. Okay, here's a church saying. If a blank don't blank, then he don't what? He don't eat. Amen. Okay, here's a church saying. Lift those hands and tell God. I thought somebody would have lifted their hands right there. Come on, let's try it again. Lift those hands and tell God, thank you. Amen. Number 11. I ain't new to this. I'm blank to this. I grew to this. Or I'm true to this. All right. Here's a dad saying or a hustler saying. Elder saying, you better get this one right. Always keeps blank to sell. Always keep something to sell. Always keep something to sell. Why we always got to keep something to sell? You always have you some money if you need it. There you go. All right. I was glad when they said unto me, let us go into the house of the Lord. Here's a street saying. It would say blank or say no blank. It's for the young folk. I know y'all need to get this one. What's up, Jay? You all right? Jay, help us out with this one. What y'all young people say when you have a conversation that y'all agree to and you will say what? Say no more or say less. Last one. You can't be no, well, this is one my daddy used to always tell us. You can't be a fool because people will hate to see you coming. You can't always be a fool because people will hate to hear or see you coming. I know I didn't fill in the blank on them. I filled in the blank. I just wanted to go ahead and just say that one. Anybody dad or anybody ever said that to y'all? You can't always be a fool because people will hate to hear you or see you coming. That's just a little icebreaker, a little street saying. I don't know. I was sitting at my desk. Anybody else got another they want to share real quick that they dad, church saying, anything like that? What about a dad quote? Somebody give me a dad quote. Something that your dad, keep it clean now. Something that your dad said to you. One I could use for my son. Come on, help me out. Anybody got none? I brought you into this world, and I'll take you out. Come on, somebody give me one more. We're going to move on. Yes, sir. Stay in a child's place. Anybody else? Give me one for the Holy Ghost. Come on. Come on, tell us something you done told Marcus before. Come on. Keep God in front. See the truth. I like that. Yes, sir. Don't let your pants, don't get too big for your britches. Don't get too big for your britches. Yes, sir. How old are you and how old am I? Yeah. In other words, you too old of a cat to get fooled by a kitty. All right. Listen, let's give it up for Dr. Mangle. He's going to come help us with some health tips and talk to us this morning and talk to us to help us to live longer. Amen? All right, come on, doctor.
thing we got to do is I'm George Mangle. I've been a Christian since 14 years old, saved by Christ, trying to live out a Christian life, not just a Christian life, being a disciple, going forth in the world, even in my medical practice, and telling people about Christ. So I think I was there in Whiteville for a while. I now work at the VA. That's enough because it's all of that's worldly stuff, and it died with Christ. It was buried, and it ain't gonna come up no more. We fighting to not let that come up. I think that what we do when we look at healthcare is we don't tie everything to the cross. So the first thing I want to do is let you know, number one, God's will is what? That we prosper and be in good health. That's his will. So many times we get worried about this cancer and that cancer and this thing and that thing. And it's really, really, really kind of simple. Number one, your body is perfect. It was made perfect. Why? In the garden, God made the body perfect, right? Adam gave this thing back to Satan, right? And so then this perfect body is exposed to evil. So why do I get sick, Doc? This perfect body is exposed to an evil world. So what did God make evil? He made the ground evil. It was cast into the ground. It was cast into the air. So now you got this perfect being that can repair itself. So I cut my hand. What happens to my hand? I repair myself. Most times when I get ill, right, my body is designed to repair itself, right? So number one, we're in a perfect body that can heal and fix itself. So the first topic we're going to talk about is what am I supposed to do to help my body heal itself, right? So then number two, you're in this perfect body in an evil world that's exposed. What is God's will? God's will is that we have good health, that we be in perfect health. So then Christ is not going to come back down and touch all of us, right? If I touch the hem of his garment, I'm what? Healed. If I can touch Christ, what? I'm healed. So he says that I'm going to leave my servants in the world that through my servants you might know me. So he take old country boy from small town Mississippi, send him to medical school and says, hey, I want you to help my people. But my word's not the last word. I just work for Dad. I just work with Dad. Dad has the last say, right? So the last thing is Doc, we face a lot of suffering and a lot of disease. Remember Nathaniel, old Nate? Old Nate got a ball, didn't he? Turned his face to God and said, Lord, look at my credit report. Says, look at the things I did for you. Remember when they were sieging the wall and came against him? He took that old letter and laid it out before God and did what God had him to do. God gave him 15 years of mission and ministry. Says, come out of your pride. I got mission and ministry for you. Sometimes things come on us that we might glorify God, pass that test, and he might give us mission and ministry. Guys, the hospital and this medicine thing is a system that's going to fail. It can't always work, because we have to inherit the kingdom of God at some point. So that's that one. And then, Doc, what's this thing? Why do we get disease? Why don't God always heal us? If God always healed us, we never sin. We never get to heaven. So see, in my mind as a Christian, it makes a lot of sense. The continuum makes a lot of sense. And so that's the first thing I wanted to do, is tell you that no matter what health you're in, no matter what you're facing, God is in control. And so as a physician, I have to kind of stand still. I see 30-year-old guys come in that, he's fine. They calling me up there, he's cold blue. He might go out of here. I see 90-year-old people come in there, they say he's going to die. That joker walk out of the hospital. So sometimes there's no rhyme or reason. What we have to do is abide with Christ, him and us, and kind of walk through it. So the first thing on this list that we want to talk about, and if you guys want to, as we go, ask questions, I'll try to answer them. I said we're going to talk about common health, okay? In the end, I'll take questions. If there are some specific things you want to ask, you can ask. But we're going to speak those things as if we want them to happen. We're not going to talk about all these different cancers and all this craziness, because if you've got it, remember with Job, that had to go through God's hand for you to get it, and he's going to help you to bear it. So let's talk about the common things that are common. So in common health, personal things is diet. What are we doing for a diet, and how do we control our diets? Nobody wants to hear it. You come in and I'm telling you, hey, Doc, my knee hurting me. The first thing you go to orthopedic surgeon, you know what he's going to say? I don't care what size you are. He's going to say lose 10 pounds. take some of the weight in the car off the CV joint so the CV joint don't wear out. Right? That's the first thing he's going to tell you. So when we look at diet, I think that in this rural area, you're probably in a better place than most. Because if you eat fresh peas, fresh greens, if you can stay away from the salt pork, if you can kind of fix things that are more natural, you stay away from those processed things. So in the processed things, some of the food dyes and some of those things that we're getting, remember those are chemicals. And anytime you put two chemicals together, go in the bathroom and put some bleach and some ammonia together and see what happens. Right? Don't mix, do it. So in our body is what we call a chemical milieu. So you've got all these different, you got insulin, you got all of these different chemicals within your body. Now I'm going to go dump some other chemicals in. Well, what happened with that, Doc? Well, we had to process food, right? Because we got to get food from those of us who live in Memphis, right? And if I just send the peas over there, they're going to dry out. So we process them, put chemicals in them. Those chemicals are broken down in our body. So number one, try to keep the diet as natural as possible. Number two, you got to enjoy some things, in the diet. But we have to, number one, be careful of carbohydrates. We can have a certain amount of carbs. What's our staple? Rice. Well, we take rice and we take the husk off it to make it soft and taste better, but what if we were to leave the husk and eat the brown rice? That husk is fiber. That fiber cleans our inside out, so we want more brown rice. We used to eat a lot of what? Sweet potatoes, didn't we? You see the man on side truck, bang sweet potato. You give him $3, man, he give you a bucket full of sweet potatoes. But we move more to what? White potatoes. So sweet potato is full of fiber. It has more fiber, so it's a better potato for you unless we do what? Mess it up with what? Sugar and marshmallows and all of that stuff, right? So when we talk about diet is very, very, very important. Now, I'm not going to be one to stand here and tell you don't go get you some fried fish. I'm not going to be one to tell you don't every then and again sit down and get you a good meal of what you want. That's what you work for. You work sometimes because, man, when I want something, I want to sit down and eat it. But we need to make in our staple diet, needs to be those things that are good for us. Fresh fruits, fresh vegetables, a good source of protein. We got to have some fat. I ain't talking about eating 4 pork chops with all the fat all the way around them now. I know that's the better part of it. But we have to put some fats like olive oils, fats like canola oil. In fact, if you're a wife or if you're at home with anything other than an olive or canola oil, you probably really should throw it away. We shouldn't be using lard. We don't like to use a lot of vegetable oils, okay? And if I had to make a diet recommendation to you, I would tell you look at the Mediterranean diet. Mediterranean diets are good. God gave us these teeth to eat meat. Meat's not bad. Everything that God has called clean, let no man call unclean. Bless that food. Eat that food. The next one is exercise. Not hard, guys. You ain't got to go and be Arnold Schwarzenegger. Exercise is instead of me parking right up here and fighting to get the first park at the back of the parking lot and walk in. My wife want me to go to all these different stores. Man, I'm going to the same store. I ain't trying to be in no store. Now, I go to Home Depot, stay in there all day. I go to Bass Pro, stay in there 2 years. But when you look at it, if you really want to exercise, park at the back of the parking lot. I know the bread is over there on that table. When I go in the store, I'm going to go all the way around to the bread. So you learn to do those things. If you're sitting at a desk all day, go ahead and you can buy this little machine that you can put up on your desk, pedal. You got a machine you can do with your hands that you can pedal. Okay, so sometimes we have to think of, okay, instead of paying that guy to come with that riding mower and cut my grass, I'm going to cut my grass. And then if you want to tie exercise into being a Christian, not am I going to cut my grass, I'm going to love my neighbor. I'm not going to just complain that they ought to be shaming themselves. All them kids over there in that grass look that bad. No, I'm going to get my exercise in. I'm going to get my love on. I'm going to go cut my neighbor's grass. In fact, I'll seek out some places that I can cut grass. So we have to find innovative ways because we're working, because we're going through life. We have to find innovative ways to exercise. Exercise is going to strengthen the muscle of the heart, okay? And it's also going to help us with weight. The next one is stress. That should be, I was told at a Promise Keepers meeting years and years ago, a man should not put his feet on the floor without first acknowledging God. So we have to find that time, be it when I first wake up in the morning, if I take 3 minutes, be it at night. My mom used to remember always make us get on our knees and pray at night before we go to bed. We need to find that time when we can connect with God and just allow the stresses of the world to pass by. Nothing's going to happen to us that doesn't go through God's hand. Conflict, when we have conflict in life many times, it's the surgical knife of God calling out sin that we might reconcile sin to the cross, that it might be buried, never to rise again. So a lot of times when I look at my conflict in the hospital, I'm the only guy there at night. I was never a drinker. I was never a smoker. But man, I was a womanizer. So when I look at it at night, a lot of times I'm going through the hospital, this nurse calling me over here, and my eyes get to wonder, I got to reconcile that thing to God. See, that's conflict, and that conflict is what's going to cause me to be in derision against God, so that when stressors come up, I can't handle them. So we got to find that time when we can just take the time to ourselves. Go out to the lake some days. You ain't got to fish, but get out there, get you a cold Coca-Cola, and just let that boat float. One of the best things you can do for stress is walk. Just get a place where you can walk. As you're walking, many times when I'm walking, I find that my mind starts to talk about and think about the things I'm going through. Makes it a lot better for me. Makes it a lot easier for me that I can get stress off. So we got to figure out ways to get off stress. If you go into a doctor, or I guess these days mostly nurse practitioners, and they begin to tell you stress is the cause of this. Somebody yesterday came in to me, they got a tremor. They say, Doc, is it stress? I said, could be, but stress is a wastebasket term for a doctor. When I done did everything else to figure out what it is, that's when I say it's stress. So we shouldn't be going and, oh, you just stressed. No, you need to figure it out first. Use what God gave us, the tools of science. After you've used the tools of science, then we're going to call it stress. I see so many times that people come in and they say, Doc, A, B, and C, and they told me it was stress. No, look at science. This. Let's get this picture. This is what it is. Okay? So that's common health. Any questions about diet, exercise, or stress reduction? It is for just good general health. In order to, it's, as you guys seeing now, I'm old common sense type guy. If you want to maintain weight, you would figure out what your basal metabolic rate is, meaning that you go to a BMI calculator, put in your weight, it's going to tell you how many calories. Simple. You don't put gas in the engine don't run. My engine runs on 1,800 calories a day. If I put in 1,800 calories, I'm not going to gain, I'm not going to lose. If I put in 1,400 calories, I'm going to lose. Now, if I put in 3,800 by going over there to the seafood junction every day in Bahia, I'm going to gain some weight. So it's really kind of simple. You can count your calories, look at what's called your macros. For every 1 gram of protein you get in, you get 4 calories. So you can count that. It's calculators out there that'll help you count that, so you'll know that what you put in, you can get out. And then the exercise factor. So if I put in 1,800 kilocalories, but I'm sitting on the couch, it's not altered. If I put in 1,800 kilocalories, but I'm doing that, cutting my neighbor's yard, walking, doing that kind of thing, 500 of calories may come out, so I'm actually only getting 1,000 calories, means I'm a negative 500, so I can tend to lose weight. And when you stop and look at it, the Mediterranean diet is just because that's what's available in that area. They live near the water, so they eat a lot of salmon, which is good fish. They had a lot of fresh fruits and vegetables. When you think about it, what's a leek? The Bible talks about they wanted what back in there, and that's that area, leeks. It's an onion. It's that old onion plant you see that we pull up. They ate those fresh fruits and vegetables. They didn't have exposure to cows and pigs. They had some pigs and some cows, but when we look at the Bible, what does it say? They offered a sheep. They offered a bull. But God had to go back because those things are not there and say, what? Bring me a dove. Why? That's what was most common to the common man. So some of this stuff that we got is because what? The king's diet, because we're so blessed. And we can't overindulge just because we're blessed. Any other questions about those three? All right, now we'll get to I'm going to move fast, Doc. Just tell me when I'm finished. Common health problems. So most of these things, I'm going to try to break them down so that they make a lot of sense to you. You go to the doctor, we put a pill in your face. We don't tell you how to manage yourself. I don't manage you. The nurse don't manage you. You manage yourself. I put a bottle in your face. If you don't take it, it's not going to do you any good. So my big thing, especially, I've been at the Veterans Association for 18 years. I'm now the overnight doc in the hospital. I work at hospitals all across the country. I work in clinics all across the country on my off weeks. So we need to understand what these things are. The first one I think everybody might have a little bit of, I would say 75% of the population, high blood pressure. Anybody know why I care about blood pressure? If I take your car and I tell you in your car you got the holes on your radiators bubbled out and you got high pressure on your radiator, what's going to happen? It's going to bust, right? So when you talking about blood pressure, I'm talking about the pressure within your system. Your system's an open or a closed system. In your body, it's a closed system, so you got a certain amount of pressure in a closed system. In that system, where all the blood going? All the organs, the heart and all the organs, right? So if I take a regular water hole, put regular amount of water in it, and shoot it on the wall, it's not going to hurt. But let's take a pressure washer and just consistently shoot it at the wall, what's going to happen? Even if it's brick. It's going to eventually knock a hole in it, right? So these high-pressure conduits, when you're producing high pressure, going to go to your heart, going to cause your heart to get big, right? Going to go to your kidneys, going to destroy your kidneys. So this high pressure destroys these organs. And in African Americans, you hear people say, what, black people get worse blood? No, we don't get worse blood pressure. We get blood pressure, young men, when we're young. I do health physicals. I'm going to do probably 100 or so health physicals in the next month, right? I see young men who have starting, African American fellas, they 17, 18 years old, blood pressure is 190 over 100. So their pressure started early. In the past, we didn't go to the doctor, so we didn't catch it. So by the time we get to you when you're 35, you got the manifestations of high blood pressure. When I look at Caucasians, they don't have high blood pressure when they're younger. They get it when they're older, but they get it a bit worse. So that's why we're controlling pressures, is because it's a high pressure conduit. If you go to the doctor and all your friends got the same blood pressure medicine, run fast. Run fast. Because we control blood pressure based on all the different conduits. So if you think about the heart's the pump that's going to create some of the pressure. But if you look at the kidney, all the blood goes through the kidney. So what happens if the kidney shuts back and pulls back some of the blood, pressure go down? If it lets the blood move faster, pressure goes up. So there's multiple conduits. In African Americans, there are certain medications that you should get for blood pressure. One of them, if you got high blood pressure, you probably know it's called amlodipine or Norvasc. The long-term studies, when I say long-term studies, what I mean. If your doctor's not talking to you about long-term longitudinal studies, you might be in trouble. Because starting back in the 1960s, we got mad about the Tuskegee Institute. It was wrong. We shouldn't have did it. But the purpose might have been okay. Because what they were doing was trying to figure out, this disease process starts here. Let's study it. So when we get here, what happened when we did this? So we got this. We did something here. What's the outcome? So over the years, I've looked at blood pressure over long term, right? Longitudinal, it wasn't a study here and a study here. I lined them all up and I studied it. So when I look at blood pressure in African Americans and I look at calcium channel blockers like Norvasc, they increase life. When I look at this hydrochlorothiazide, this water pills that men who have to work every day hate because I can't leave the line to go to the bathroom. that also increases life. If you're a diabetic, diabetics tend to have what? Worse kidney disease, so I put you on a particular high blood pressure medicine. If you've had a heart attack, I put you on a different medicine. So it's not just about getting a pill, but it's about getting the right pill, okay? So number 2, does vinegar work for high blood pressure? All the things old people said, you know, the cumin, does all that. It does. The reason why it doesn't work well is it doesn't work long. You can take vinegar, your blood pressures will come down, but it won't stay down long. That's the reason why I coated that pill and gave it to you, so that it could last long to bring your pressure down. Those blood pressure are nothing but common herbs and those type chemicals that we saw that work, that we reproduced in the lab so that they'll work longer. Okay, so blood pressure, is it tied to salt? Some of those studies have gone away. You still don't go out and eat a whole lot of salt, but it's not necessarily tied all the way to salt. Remember you say you eat a low-salt diet. Yeah, you want to decrease the low-salt diet. Why? Where salt goes in your body, water goes. So if I take salt, I take water, I'm a whole water, pressure goes up. We thought by dumping all the salt out, pressure would go absolutely down. That's not true, because the body will go back around a different way to a set point in the brain. So my brain say my pressure been 190/100 forever, right? You give you something and you take your pressure down, what your body gonna say? Oh no, my pressure been like this forever. I'm gonna use the kidney now, or I'm gonna use the heart now to take the pressures up. Why? Most people on 2 or 3 blood pressure medicine, because your body set point says, I don't want to go down, but we're going to bring it down. That's why you can never stop taking that blood pressure medicine. Now, you get older sometimes, those vessels are not as compliant. You can stop. Any questions about high blood pressure?
Side effects of some of the medicines, side effect of some of the medicines that are being taken. I understand that there could be ED problems, visual problems. Can you address that?
Benefit and risk. Benefit and risk. Okay, so you go up to Joe and tell Joe, my radiator leaking. Put some pepper in it if you don't want to pay me. If you don't want nothing, put some pepper. Or I can fix it, but it's going to cost you. So what ends up happening is we talking about a chemical maloo, right? So I got all these chemicals, right, that I'm putting in. And I'm putting in substances that are not 100% natural, right? So you're going to have some side effects. As long as those side effects are controlled, and the benefit of decreasing my blood pressure, not letting me get a heart attack, not letting me get a stroke, not letting my kidneys go down, making me able to live my life, that benefit will probably outweigh the risk. But if you get ED, I got medicine for that. Or I can just change your blood pressure medicine to something else. Does it make sense? Yeah. And sometimes it's just a matter of switching the medicines. Not all blood pressure medicines cause you to have ED. And we'll talk about ED in just a bit here. So I don't have a good answer to tell you that don't take the medicine, because if you eat too much pork, side effect, right? If you eat food with dyes in it, side effect. If you go in the wrong part of Memphis and you ain't got a 9mm, side effect. So you see, everything could have a possible side effect. So we have to manage the effects of those medicines. Yes, sir. You can. You just have to be very, very careful. Number one, weight loss will reduce the blood pressure. Number 2, like we say, low sodium diet. But you have to be very, very careful that you're monitoring the diet and you're monitoring the pressures. I would never say don't treat. The Lord gonna fix me and get better. If the Lord was gonna always fix us, why he take me from Clarksdale, Mississippi? Mother was a maid, no money at all. Send me to Mississippi Valley. Send me to medical school twice. Because he says that I'm going, if he was going to do that, he wouldn't have to keep me in the world. I might well go and go to heaven. He says that I'm going to allow Dr. Mangle to do what he do to bless my people.
Excuse me. If you have a question, please let me give you the microphone because we're going live, so we won't be able to hear the question. What was the previous question you just asked?
Could you change your diet to get off the medicine? One of the questions I have is, can you live longevity on medication, whether it's diabetic, high blood pressure, high cholesterol? Can you have a normal life with the medication? Not making any excuse for the medication, but we know for some people they may need the medication. Let's say, for instance, you're on amlodipine. Lifespan being on amlodipine is what I'm asking.
Okay, there are certain medicines that increase length of life, and that's what those long-term studies. Norvasc is one that in the African American group does increase length of life. Let's say, for instance, you have problems with your heart and your cholesterol. Well, cholesterol in and of itself can clog up the pipes and cause you to have some problem with your heart. If I control your cholesterol indirectly, I'm going to increase your length of life because you won't have that heart attack, so I prevent you from having that heart attack. So most medications, that's the goal. The goal of what we do is to not only give you an increase in length of life, because many times a person will walk in and they'll have cancer all over their body. My object then becomes not necessarily to get rid of the cancer, or sometimes I can't increase their length, but I can make their life more enjoyable while they're here. So there's several reasons for those outcomes. Okay, the next one on the list is diabetes. A lot of diabetes.
Yes. What about that lisinopril? Is they good medication for blood pressure? Lisinopril?
Lisinopril is a good medication. Before we got the box, right, the computer box, Facebook, and where people could show all these people, all these pictures in YouTube, we didn't know about the facial swelling. So we get this facial swelling. It can swell your throat. It inhibits what's called substance P, I think it is, with that one. But anyhow, at any rate, it can cause your face to swell, your throat to swell, can cause a cough. That's just a side effect. It's no rhyme or reason. It can happen on day 5. It can happen after 5 years. We do have medicines, one called losartan, that'll decrease the cough. But that's just a natural side effect. If you have diabetes, that's a preferable medicine. If you have some heart disease, it's a preferable medicine. So in certain cases, if you've got chronic kidney disease and your kidney is wasting protein, that's one of the medicines we use. The other one is losartan, which is lisinopril's brother, that doesn't have as many side effects. And now we're coming out with some other medications in that same area that kind of do about the same thing. So lisinopril is okay. It just depends on your profile.
I got a question. What about metformin?
So we go back to diabetes. Metformin is the oldest drug in diabetes, and it's one of the best ones we got. I know we got a lot of new stuff. So let's talk about diabetes for a minute. I'm going to try to move as fast as I can because I know that's the reason why I want to talk about common things. Diabetes, number one, you don't have your insulin's not working. What is insulin? Insulin is going to go to that door. You eat your food. You're ready to take in your nutrient. Insulin goes to the door, knocks on the door, pushes the button, opens the door so your cells can take up the sugars. Your cells don't take up the sugars circulate in your blood. What happened? They get into the small blood vessels. What are small blood vessels at? They're in your eyes, they're in your kidneys, they're in your testicle, they're in your end organs, right? And so that's the reason why where sugar goes, where sodium goes, water goes. So when most people first got diagnosed with diabetes, what they do, doc, I'm peeing all the time. Doc, I'm losing weight. Can't use your nutrients. Sugar dumping out into your urine. I'm peeing all the time. Okay, and so that's kind of what diabetes is. So we've changed what we do for diabetes. It's a fascinating time. I came up in the old school, old doc, hey, what's the sugar? That's what they cared about. What's the sugar, doc? You get the sugar down? Nowadays we're doing what's called a cardiometabolic profiles because we know now that controlling the sugar alone in diabetes still have a huge number of heart attacks. You come into me as a diabetic and say, Doc, my chest hurt, you automatically bought a hospital. I can't even argue with the I argue with the emergency room doctors all the time. Send him home. He won't live with it. He won't be with family. He won't be in the hospital. I can take care of him outside. I get him what he needs. But you come in and say you got chest pain, automatic hospital. Because diabetics have so many heart attacks, so many problems with their vessels, their blood vessels, that we know that's a common outcome, right? So now we're doing what's called a cardiometabolic profile, Ozempic, right? You see this, Rybelsus. Those medicines now work by way of the gut because what's your problem? Sugar and insulin. So now those work by way of the gut. That's why they cause you to lose weight. That's why all the women want it, right? It's because it's going to cause them to lose weight. But they work to not only decrease the sugar, but we got one called Jardiance that you ain't even got to have diabetes. If it's something wrong with your kidneys, we give you Jardiance. So those medications now are not only decreasing your blood sugar, but they're helping your heart, they're helping your kidneys, and they're helping all those different profiles. So if you're on an older regimen for diabetes, trying to get back into a physician, many times an endocrinologist who can say, okay, we've been doing this way, now we need to, I always use metformin. It's a Bigonide, it's been around forever, it's a really good drug. Your sugars really won't go low with metformin, very rarely, because what it does is it goes over to the muscle, says to that doorbell, it augments the doorbell, so the doorbell being this big, makes it a big old target, so that your vessels can open up, so that your cells can open up and take the sugar in better. So it's a pretty good medicine for diabetes. In diabetes, we worry about your eyes. You should get a yearly eye exam every single year. Why is that? Small vessel, remember? All right. The way I get a lot of men at the VA, they come in, they say, Doc, that old thing won't work. I can't, man, okay, you get sugars in control because small vessel. It's a small vessel there, right? And most of the time, if you control your sugars, your erectile dysfunction will improve. Kidneys, the number one thing with kidneys is small blood vessels clogged up. We see more people with diabetes having chronic kidney disease in dialysis than anybody else. Number two, Doc, my feet hurt, and I got a sore on my feet. Small blood vessels, right? You lose that nerve ending, that's a small blood vessel. You don't get feeling in your feet, you get a sore. Now my blood vessels and my nerves bad. I can't get the antibiotic down there. Chop, chop. So it's very important to not only control the sugars, but control the cholesterol. Every diabetic in this day and age should be on a statin drug, should be on a Pravachol, a Lipitor, or Crestor, one of those medicines to decrease cholesterol. So that's kind of where we are. So now we're doing this metabolic profile where not only are we controlling your sugars, cholesterol, and all these other factors in diabetes so you don't get to those end points. And the end points being heart attacks, strokes, and those kinds of things.
I got one more question. What about cinnamon concerning diabetes? Is cinnamon good?
Cinnamon is not only good for diabetes, it's good for blood pressure, it's good for a lot of things. But again, those are natural things that you can use, but remember, it's natural, it doesn't last long. So when I go to my doctor and I'm saying I'm gonna use cinnamon, if they tell you, oh, it works, we know it worked because that's all we had. How do we know it worked? Well, we couldn't go to the doctor because they wouldn't let us go to the doctor. They kept us on the farm or they beat us, or they told us you got to go in the back room. Boy, you can't go in there. I had an office right down there in Whiteville from, I forgot the guy's name. Well, when I went in that place, it had a white side and a black side down there in Whiteville. So we couldn't go to the doctor, so we knew it worked because that's all we had was cinnamon. I would tell you to use cinnamon in your diet, but I wouldn't tell you to use that solo. Use it to, watch this word, augment. It's an all and, not an either or. It's all these things and this thing, not either this or that. Because when I get into either or, I'm headed this way, I can't turn. But if it's all in, I got this avenue, I got this avenue, so I can go some different directions with my medicines and with my cinnamon. The biggest thing for diabetes is diet. It's a king's disease. So when we study diabetes, they tell you that this is a disease of the rich. So when you look at old times, only the rich got it. Why? Because they had the highly processed foods. They ate more of the breads and more of those things. So it's really, really diet, controlling the diet.
I got one more question. What about the drug Xarelto?
It depends on what you need Xarelto for. Xarelto is a pretty good drug. I don't want anybody to ever be on Xarelto. Xarelto is used if you've had a clot or if you have had atrial fibrillation, which is a problem where your heart doesn't beat right, causing you to have a clot. What it does is, remember old warfarin? Warfarin was one that we put in rat poison for years. You would take the warfarin, you would put it in the rat poison, put it in some meat or something, and put shards of glass in it. Rat eats it, it causes him to bleed because his inside rat dies. Well, what we found out from that was people make clot. You naturally make a clot, right? So if you cut yourself, the first thing you're going to do, the platelet's going to go when they're going to do this. The platelet's going to fill into that void, close that void off, but the platelets can't stay there forever because the blood going to wash them out. So you make a clot. You naturally make a clot. When you naturally make that clot, it fills in that hole, right? So warfarin is what we used to use to thin your blood if you were making a clot. When was a clot bad? Clot go over to your brain, you got some problems, it's called stroke. Clot go over to your heart, it's bad, it's called a heart attack. Clot go over to your lung, it's called a pulmonary embolism. You can go just like that. When we saw COVID, and you heard about those young people that was in their dorm rooms, COVID, that was the worst thing we could have ever did because we didn't know that COVID was causing these clots. Young lady sitting in her dorm room, she got COVID, she found her dead, she had a big clot went to her lung because we know that for whatever reason, COVID produced those clots, right? So if you're producing clot, Xarelto is one of those medicines that you don't have to go to the doctor every single week and get your blood counts checked. We know that it controls your amount of anticoagulation just by that certain amount of drug, so I don't have to adjust. It used to be before we used these, you would have to come. When I was at Whiteville, people would come in there and see that young lady every week to get their blood thin, see how thin their blood was. Now Xarelto, the better one I think is called apixaban. Xarelto you take once a day, apixaban take twice a day, but when you look at the long-term longitudinal studies again, right, that apixaban didn't cause as much bleeding when you have to have bleeding. Now, you can't skydive no more. You can't really skydive. You really shouldn't be doing a lot of hunting. You can't do a lot of motorsports. Why? If you have a car accident or something, you got to go straight to the hospital. Why? You're going to have a propensity to bleed. I took your ability to clot away. If you fall and hit your head, go to the hospital. Why? Your ability to perform a clot to stop you from bleeding has been taken away because clots for you were pathologic. They caused disease. I took that away, right? So now you can't make clot. Does that make sense?
Borderline diabetic.
No such thing as borderline diabetic in my mind. I still believe in the old teaching that you are diabetic or not. You have what's called impaired glucose tolerance, meaning that you got your sugars in your blood, but you're not handling your sugars well. We base that on calling hemoglobin A1C. I'm going to try to make this simple, like we do in everything else. In your bloodstream, you're supposed to process your sugars, right? If you're not processing your sugars and your blood and your sugars in your bloodstream is staying high, I can look at your red blood cells, right? Look at the light refraction of your right blood cells, so of your red blood cells, right? So if you've got high sugar, let's say for instance you got a fish in a stream with no mercury. When I look at that fish, I take that fish out of water to eat, I take it for mercury, ain't no mercury in that fish, right? So ain't no mercury in that lake. So let's say your bloodstream is the lake. That glucose is the mercury. When I take that red cell, because those red cells got to circulate, right? All the time, I take it out and I look at it. Around that cell is coated with sugar. That's impaired glucose tolerance because your sugars are high. And when your sugars are high, it means that you're not necessarily processing sugars. What would I do? Diet, and I start a cardiometabolic medicine. I know, I don't want to take no medicine, doc. I don't want to spend my money on no medicine, doc. But if you start now and you decrease those sugars and take that medication, what do we say all this is designed to do? You don't, hopefully, prayerfully, you don't get to that end point. That's cool? Any other question about diabetes? So y'all just want to turn this to a question and answer? Seems like we got a lot of questions instead of me doing this. Okay, so the next one on my list is benign prostatic hypertrophy. Okay, what's the symptoms of benign? Every man got a prostate. What does the prostate do? When we were younger and we're producing semen, right? Think about it. Very, very small organ. You can't even see a sperm cell. So the route, the amount of distance, and I forgot what the exact calculation is, the amount of distance for your sperm to reach the ovary to produce a child is miles and miles and miles for that sperm. So the sperm got to have something to eat, right? Your wife's chemical milieu, the chemicals of her body actually don't want her to have a baby. They produce substances, even the pH or the acidity of the vagina is set up so that that sperm won't survive. So what the prostate does is it produces a seminal fluid, right? So when it produces that seminal fluid, it produces an acidic substance that'll take the pH down so that even the sperm can enter. It leaves fluid. It gives food. It provides everything that sperm needs to make it up to the ovary. But over time, we don't use it. You go out there and get a brand new, I saw those nice trucks out there. You get that brand new 2024 Ford truck. How them gaskets gonna look? They're gonna be springy and rubbery and really, really nice, aren't they? But over time, after that engine has heated and been used, go look at that same gasket. It's going to crack, it's going to swell, it's not going to be the same. In my mind, that's the way I think of the prostate. Because when you were younger, you were using that organ all the time. It was fluid, it was being used, it was being lubricated, so it's just a regular prostate. But over time, after it wasn't used, and that's just age, you know, you don't produce sperm anymore, you're not producing seminal fluid anymore, it swells. That's what benign prostatic hypertrophy is. So all of your urine has to come past, just as your ejaculate would, right? Had to come past that prostate, right, to come out. When that urine comes past that prostate, if the prostate's large, I got a little small hole. I'm starting to close the hole down. What's going to happen? Doc, I can't make it to the bathroom. Doc, when I go to the bathroom, I had to stand there and sing 2 verses of the song before it come out. Or Doc, when I'm peeing, I start, stop. I start, stop. Doc, I pee. Man, I got to go right back to the bathroom, pee. Those are signs of benign prostatic hypertrophy. There's a good herb out there for that one called saw palmetto, if you catch it early. Other than that, we treat benign prostatic hypertrophy with a couple of medicines. Tamsulosin is mostly what we use, and there are some other medicines for benign prostatic hypertrophy. Doc, is that prostate cancer? No, 2 totally different diseases. Benign prostatic hypertrophy, young men keep living. We say almost all men will eventually end up with some prostatic hypertrophy. And that just means the prostate has gotten large. It's not necessarily cancerous, and so you don't urinate as well. Any questions on that one?
At what age should men, I know I've heard it, but they moving the date back now for men to get checked for prostate.
Anywhere from, I think now it's 35 to 40 years old. You mean for prostate cancer?
Well, yeah, you know how, yeah, checking for prostate cancer, I guess.
Yeah, you're just now, we used to do we used to do more, and I still believe in it with my men, I still do it. You know, men used to hate to go to the doctor because they got to get the finger test. What I'm looking for is a nodule, okay? So let's go back and think about what is a cancer, doc? So a cancer is anytime, you know, God, I told you, man, this body is beautiful, man. You want to study a machine? Man, it's beautiful. God put a clock on every cell. So that clock tick, 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 when it's time for that cell to die, clock turn off, cell die and come at your body. But now, when that clock on that cell doesn't die, that cell stays there. Well, his buddy got to get his job. Yeah, I got time for me to come, so you get another cell. So anytime you get this hyperproliferation of cells. You get too many cells and the clock doesn't turn off, that's when you got a cancer, okay? And so when is a cancer really, really bad? So if I got a prostate cancer and it stay in my prostate and I can take it out, it's fine. But let's say what'll happen to a piece of prostate if it go over and knock on Mr. Heart though, and say, hey, Mr. Heart, and prostate usually goes to bone, doesn't usually go to heart. But let's say it goes over to the heart and it says, I'm gonna move in next door. Well, heart says, I ain't got no room for you. That's what's called a metastatic cancer. So when I get a cancerous focus that moves out of that place where it normally grows, it goes somewhere else and it impedes that organ from doing what it normally does. Doc, my mama had cancer all over her body. Wherever it was, it got out, so I couldn't control it. If I catch let's say I catch a piece of lung cancer in the lung, and I go cut it out, and I don't see it no more, I got it. You got a cure. But if I say it's in your lung, and I say it's in your blood vessel even, you never will really get a cure because, okay, it got out of your lung and your blood vessel. I don't see it nowhere else, but is that joker hiding and this is gonna come back? So those people, a lot of times we say they're what? In remission. We don't know. That's why you go back to the doctor every year. So now back to prostate cancer. Almost every cell in your body produces a certain substance. So the prostate will produce what's called prostate-specific, grows only in the prostate, antigen. And when that's high, and I'm almost sure it's 35 years old. I'll look that one up and tell you. That now is in the computer. So when you come in, 35 years old, it clicks up, do this test, if we're doing what we're supposed to be doing. But I'll look it up and tell you. But prostate-specific antigen is what we look for in prostate cancer. A lot of times we worry about prostate cancer, but guess what? Guess what we found prostate cancer most of that made us scared? Guys that had already died. They were dead from something else. We found prostate cancer in their body, and so we say most men gonna have prostate cancer. Most men die with prostate cancer, not of prostate cancer. Okay. Now that don't mean we don't pay attention to it. That don't mean we don't do something about it when we see it. But it is something that is not as bad as we think. Anything else on prostate? About an hour, Doc. You want me to stop? It's 10. Okay. Okay. The next one is heart disease. And we see a lot of heart disease. You can have what's called organic heart disease, heart attacks. It's a lot in heart disease. And as you guys got questions, we'll ask about it. The one in heart disease I think that we worry most about is heart attacks. So we do what's called a heart score, actually. If you've got high blood pressure, it needs to be, what are those foci that's making me have worse heart? Number one, controlling the cholesterol. Number two, you have to control your blood pressure. Number three, good exercise, because if I pump a muscle, I strengthen a muscle, that muscle is more likely to be used perfectly. The other one is one that we're seeing called organic heart disease. So I get a guy come in, he say, Doc, I'm swelling. I try to walk over here, I'm short of breath. That can be what's called organic heart disease and what's called congestive heart failure. When you get congestive heart failure, it simply means the pump's not pumping well. Okay, so the pump should be, if I give you a glass and I put 10 balls in that glass, every time I turn the glass over, or every time the glass empties, at least 6 balls have to come out, 5.5 to 6 balls. If it's less than that, that's congestive heart failure. I'm not emptying the heart. Well, the heart and the lung is one circuit. So if I'm not emptying the blood out of my heart, where it's gonna go? It can back up in the lung and all over the body. So that's what congestive heart failure, it's an ineffective pump. Also, if your pressures are always high, you can have high pressures in your heart. So the pressures in your heart staying high, so your heart can't close the pump, can't close the pump. So it's like this, it's doing this to pump. So that will also make you have congestive heart failure. So it's 2 different ways to have this organic congestive heart failure. That's one that we really treat. Jardiance, a diabetic medicine we use in almost every heart failure patient. We use water. The lisinopril. Lisinopril is one. It works on the blood vessels. So if I've got a blood vessel that's like this and my heart's trying to pump, it's going to fight. I take the lisinopril, it does what's called afterload reduction, open that pipe. Think about it. Now, the heart's a Cadillac. It ain't a Yugo no more. It's sort of make you push more blood out. That's when we absolutely use an ACE or an ARB, and we got one nowadays called Entresto. You see it on TV that really, really works well. We use one called spironolactone, so we have a whole lot of medicines in congestive heart failure. If you have congestive heart failure and you're not short of breath, you ain't got no fluid, you don't need Lasix. The only thing the water pill does in congestive heart failure is make you not feel better. But all those other medicines and what we call goal-directed medical therapy, I'm trying to get to an end point. I'm trying to get your medicines to an end point to stop you from getting to an end point. So if you got those type things, you should be seeing somebody regular. They should be changing your medicines regular. If you diabetes, you shouldn't be going to no doctor every 6 months, once a year. If you do, run fast. Find somebody who's going to sit down, talk to you, help you understand your stuff, and adjust your stuff. And we talked a little bit about high cholesterol. So high cholesterol is going to be a lot of diet, olive oil, canola oil out of two you want to use. These statin medicines got a bad name. Remember, we had one called, what was the name of that one? But I know Lipitor is one. Remember they said you take that medicine, it's going to make your muscles hurt, make your muscle break down, make you have arthritis. Initially, we thought that, but now these cholesterol medicines, we got ones that are water soluble. They decrease your cholesterol. They help prevent you from having kidney problems. They stop you from having heart attacks. They prevent you from having stroke. Guy come in having a heart attack now, I give you an aspirin, but you know the first one other thing I give you? I give you a very high dose cholesterol medicine because they decrease inflammation across the board. So what about back to diet? Again, healthy fats in our diet, and then kind of exercise and controlling the cholesterol levels. Anything else on that one? Is there any other common, I know you guys going to say, what about COPD? To me, for Christian men and for healthy men, COPD don't exist. Why? Lung cancer can come on very rarely if you don't smoke. That's a vice. You know you shouldn't smoke. So that's not something even to talk about. I mean, a guy come into me talking about cigarettes. Don't waste my time. Why? It's all over everywhere. You shouldn't be smoking. Guy come into me drinking 2 pints a day. Dude, don't waste my time. You don't need to come to the doctor. Go on to the liquor store. When you're ready to come to the doctor, I work for the federal government, man. Don't waste my time. You know, if you're drinking excessively, if you're smoking, if you're having multiple women with sex without protection, you wasting the doctor's time. Because you know that there's a consequence to that, and the outcome of that consequence is most likely it's going to come. Look at the book. Very rarely do you see there being a sin committed to which God didn't produce a consequence. Even the great David, man, that man was after God's own heart. David messed up. God said, why you count the people? Choose your poison, David. Who's going to whoop you? So a lot of those things that we want to talk about, I don't even count them. And a lot of the guys, they get upset. I'm on the administration. You can't talk to me like that. Go tell him. I tell him when I sit in his office, dude, if you ain't telling them not to smoke and they got COPD, what you doing? So tobacco use, excessive alcohol use, and some of those things are really not good. Okay. And then the last one was, and we really went there, common health, and these are potential kills. So alcohol. Too much alcohol, we know is going to affect your liver and take you into cirrhosis. Doc, what about a glass of red wine or a shot once a week? Not really bad for you. Kind of can help with your cholesterol, kind of help move some things along. What does the Bible say about it, Doc? Well, the Bible, I hear guys tell me out there, well, Doc, they say alcohol good for the gall. It says a little wine is good for the gall, right? It didn't say alcohol in excess was good for you. Anything in excess is not going to be good for you. And why don't we, as Christians, indulge? Well, really, you have to look at what Paul says. I think it's over in the book of Romans. He says if a man want to eat, we ought not do something that offends another man that goes against his conscience.
So if I know the next fella can't control his drinking, what am I going to liquor store for? I'm a Christian. He see my car parked at the liquor store. He drank. So we ought not do things that's going to lead other people away from the cause of the Christ. We have to learn to sacrifice ourselves. That, man, I sure do want me a good old shot today. You know, I'm going to sacrifice that so that someone else doesn't fall off the bandwagon, and that's how I kind of handle it. That's how we're taught to handle it, is that we don't drink lest another man fall. And number two, if it's a small amount, maybe a shot a week, if it's a red wine made from the grape, you can also have that for cholesterol. But I don't understand why we would not just drink grape juice. So alcohol, tobacco, you want to give a rat cancer, put it in a tobacco chamber, put it in a smoke chamber. Every single time, just about, they're going to get cancer. So we know it's a carcinogen. I don't really see any positives out of smoking at all. From all of the time I've been in, I haven't seen. There may be one disease they say, well, smoking won't hurt you. But tobacco, cigarette smoke is just terrible. Vaping, what about vaping? So I'm going to go from a smoke to a lung that if I put water in it, it's going to drown. Bad idea from the beginning. So I'm going to take nicotine, which is an addictive drug, put it into a mist, put that wet mist in my lung. Because the worldly system is bound to fail. So vaping, the studies are now coming out with vaping. It is just as bad and probably going to be worse than was regular smoking. What's the next one? And we did vaping. Okay, and the last one, and then we'll take the other question, is emotional distress. So the big problem we have is men don't want to talk. Men, ain't nobody going to tell me. And what ends up happening is, especially when you look at the place we are in America with, we jumped on the on the Obama bandwagon. We thought Obama was the best thing since sliced bread. So African Americans get this very, very high. Then we go from Obama over to the next president, but then we come into this Trump era where we get this kind of swing where now it's the worst thing in the world. And rather than us having open dialogue, where we can sit down and express ourselves and kind of get some of these stressors off, we see men being killed in the streets. Even over there in Memphis, we see our own black men kill another black man in the streets. We see all of these things, and we don't necessarily sit down and have open dialogue and talk about all these stressors. I'm at work. My boss is a Trump fan. He feel like he can do what he wanted to do to me. When I was at work and Obama was in office, I couldn't say nothing because of the white folk. So what we have to learn to do is tie everything back to the context of God and figure out who we going to talk to, how we going to talk to, take some of these stresses off. Doc, me and my wife going through problems. I don't want to talk about it. So it's so many times I can see a man when he's sitting in there with me. You can just see it. He's stressed, but there's no one to talk to. So for men, finding that place of safety, finding that person who I can talk to that's not only going to allow me to express myself, but see, you can't fix foolishness with foolishness. See, I can't fix Trump foolishness with Obama foolishness. I got to take all of this stuff and say, these are systems that's going to fail. Every system that we deal with, my profession going to fail. Why? Christ got to come back and the kingdom got to come. This world ain't going to make it. If it made it, we wouldn't need the kingdom to come. Christ got to come back. So it's going to fail. So we got to take all of those things, find those emotional places where we can sit down, talk to people who going to help us reconcile these things back to God so that we can take some of the stress off. Because, guys, stress is a driver. It can cause you to have a lot of problems that you didn't have. And with stress, this is what I think with stress. I think it takes us out of the ability to make good decisions. I think that we get stressed, and when we get stressed, we're not thinking right, we don't take our medicine, we don't do all those things that we were supposed to do to kind of do everything else we talked about in this talk. So We have to find that place to take that emotional stress off. The ability to correctly, appropriately, in love, talk about those things that are offensive, those things that are against God, those things that are just kind of bothering us. When we're talking about being disciples, talking about Christ, it's going to be controversial. But we still have to figure out, how do we get into those avenues? How do we do those things? How do we relieve those stressors so that we don't get into that place of being PTSD? We don't get into that place, I'm just distressed, I'm just depressed, I'm just got anxiety. And so that's what we really, really have to do with stress. And I think groups like this is kind of what you need, where Christ never sent them out one by one. He always sent them out two by two and gave them a partner. So that's all I got. If there's any other medical illness, most of them I pretty much got in my mind, read about them. I can talk about them briefly if there's anything else you guys have.
What's your take on neuropathy?
It depends on the cause of the neuropathy. If the neuropathy is from diabetes, we have medicines to overcome the neuropathy. These are what's called anti-epileptic drugs. So what they did was they were working on people who had seizures, and in fixing those seizures, they found that they calmed those nerve endings, and it took the burning and stinging away. So we use gabapentin is the big one. We used to use one called amitriptyline. It didn't work real well. Gabapentin, and now we got Lyrica and those. But you have to figure out the root cause. So it doesn't always have to be diabetes. If a guy has, I remember a guy over in Whiteville that I had that had pain. He initially had pain in his leg, but his leg went numb. Well, he got a bad disc. The disc slid back on the nerve. When I think of a nerve, think of an electric cord, right? So you got this electric cord in the wall. If the table hits the electric cord, that electric cord is not going to produce energy, so you don't have any feeling, or it's going to produce shocks. And that's kind of what neuropathy is, where those nerve endings have either been damaged or they're being damaged by something in your back. Sometimes, very rarely, we can get tumors that'll cause that. You get some people that get cancers. That cancer will get in the spinal cord, push on those nerves, and they'll get that burning, stinging type pain. And so the medicines are pretty good, but once you get a neuropathy, especially in your feet, you got to really get a mirror and look at your feet. Because remember, you'll get that sore. It's been there for 2 weeks. I ain't know it because I can't feel it. So the medicines work pretty good. The last one is the vaccines. We forgot the vaccine, Doc. Let me hit the vaccines right quick. Number one, COVID. Don't believe the hype about COVID. COVID was real. We saw people die. We saw colleagues go down. It was real. It's a real phenomenon. The vaccinations work. How do I know they work? Let's say you come in this room, and all of us been in this room. We've been in the church together for years. All of us have been working together for years, and all of a sudden, Joe not there. All of a sudden, Henry not there. All of a sudden, Dorco not there. And you ask somebody, what happened to those guys? They dead. They gone. They got them. And you come in to me and you say, Doc, you want to go home to your family? Yeah. Let's give you this shot. Give it to me. We tried it out first. I haven't seen anybody grow. I haven't seen any of the docs with 3 eyes. I haven't seen many side effects from it at all. So the COVID vaccinations, they work. So now, because we have a good medicine for COVID, COVID. If you get COVID, you got 5 days to tell me the medicine is not a Trump medicine. It's not a political medicine. It's an old antiviral that we used in the past that works what is called Paxlovid. And there's several other older medicines that we use. Flu shot, should get flu shot every year. Doc, but the flu shot make me sick. Watch this one. It's supposed to make you sick, right? It's actually a biblical principle. I mean, if you know the thief is coming, would you not prepare? So I know you're going to get a new flu going to come around every year. So what I do, I take the virus, I kill it, I put it in an egg, I let it be reproduced, I give it to you, it goes in your body. What does your body do? Produces those things which it would need to fight the flu this year. So guess what it's going to do? It's going to cause me to have a little fever. It's going to cause me to have a little, why? My body's doing the same thing it would do if the flu was live, but my body doesn't have to fight as much. Why? I got a dead flu. So my body just really, not really fighting anything, it's giving me the defense if I need to put the flu off. So we should be trying to get the flu shot. Pneumococcal pneumonia vaccination, we got it now, Prevnar 23, pneumonia 23. It's going to expose you to all the common pneumonias so that if you encounter them, your body's kind of ready for them. The hepatitis is most gentlemen, if they hadn't been in the military, doesn't experience hepatitis. For every guy in here, you need to make sure your tetanus is up to date, because you hate to be up on your house, you're working on your house, you're getting things done, you step on the nail, you want to get finished, but now I got to go to the emergency room and get a tetanus shot. If you keep your tetanus shot within 10 years, you just say, dog, you put that old rag with that colloid on around your foot, right? Right? And then you get kind of finish doing your house. So your Tdap is one that you kind of always want to get done. And I think that is all of the vaccinations that we kind of do, flu, COVID. Okay, so that's all the vaccinations. Anything else, any other questions? All right, guys, thanks for letting me kind of share with you guys. I'm sorry it went a little bit longer than we thought. I hope it was productive. And if you guys have any other questions, I'll leave an email. Now, I can't get into a lot of the kind of personal things. I can give you some advice, but a lot of things like with your doctor, it's not godly for me to kind of, to overjudge somebody or to try to, say something negative or bad about somebody. But I can try to give you some common advice as to, I got this and this, who should I see? Or I got this and this, is this right? I can kind of make some general comments.
Doctor, I have a question. You have an office, and where is it located?
I work for the federal government. I work in the VA emergency department, not emergency department. I was in the emergency department 15 years. Now I'm the hospital doc at night. And then other than that, I work at various agencies in the hospital. So I only do hospital only. Derek, one of the greatest guys I know, man, a man of God who loves God, a very strong guy. Derek went to an Ivy League. You guys got an Ivy League, man. I went to some nowhere medical school, man. Derek went to Brown, which is, man, one of the best medical schools in the country. He's a pediatrician over here. And me and Derek been friends, for a long time. That's it. I can go.
Appreciate you. Y'all clap your hands one more time for Dr. Mango. Listen, we're going to take about a 5-minute break, just a quick 5 minutes. If you want to step out and do what you need to do real quick, let's take 5 and we'll come right back. Okay? All right? We also have some things over here on the table. I don't know if y'all want that now after that session, but we got a little something on the table y'all want to get real quick. Get that, and then, use the restroom, whatever you need to do, and we'll be right back. If you're watching us Facebook or YouTube Live, if you have a question, type it in, and we'll get that question for you, and so it can be answered. Thank you.